Two clinical variables can move together without either one causing the other. Biomarker correlation is a property of a joint patient distribution. It measures how much two variables covary across patients. Clinical causation is a property of a mechanism. It measures what happens to a patient outcome when you change a treatment. These are different questions about different objects. A biomarker association can be high even when there is no causal treatment connection. The direction of clinical causation cannot be read from an association alone. Conditioning on a treatment observation means restricting attention to patients who received that treatment. This produces a patient subgroup that was not selected randomly. Conditional clinical probability describes what co-occurs in that subgroup. It does not describe what would happen if you assigned the treatment to all patients. Conditioning observes a patient subgroup. Treatment intervention changes the clinical system. A clinical intervention means externally assigning a treatment to a patient. This is different from observing that the patient happened to receive that treatment. When you intervene, you sever the treatment from its natural clinical determinants. The patient outcome distribution after intervention is not the same as the conditional distribution of outcomes given the observation. These two operations produce different clinical numbers. This distinction is the foundation of randomized controlled trial design. A clinical confounder is a variable that affects both treatment assignment and patient outcome. When a confounder exists, treatment and outcome move together even without any direct causal link. The observed association reflects the confounder's simultaneous influence on both. Conditioning on treatment does not remove the confounder's effect on outcome. The confounder acts through a separate pathway that conditioning on treatment does not block. The conditional outcome distribution misleads about what the treatment intervention would produce. Conditioning on a treatment value creates a patient subpopulation, those who received that treatment in practice. That subpopulation was not selected randomly. It was selected by the clinical process that determined treatment, including the confounder. Outcomes within that subpopulation reflect both treatment and the confounder simultaneously. A randomized intervention would assign treatment regardless of the confounder. These two operations produce different patient outcome distributions. One is clinical selection, the other is clinical assignment. When a confounder determines both which patients receive treatment and their outcomes, aggregating across patient subgroups can reverse clinical conclusions. A treatment can appear beneficial within every severity subgroup but harmful in the aggregate. Conditioning on treatment alone is a descriptive operation on observed data. It does not describe what would happen if you acted on the clinical system. Conditioning cannot identify treatment effects when clinical confounders are present. Every clinical protocol implicitly assumes a causal structure. Conditioning alone does not provide one.